Compassionate Communities is a local initiative between the Coventry and Warwickshire Partnership Trust and UHCW, and we have a group of volunteers who offer support at home or in hospital to people who are dying or recently bereaved. We are currently looking to recruit more volunteers, particularly volunteers who are happy to work in the community. They will very often be working with people who are very isolated and vulnerable and really need somebody who can just pop by, check how they are in a very non-medical role and offer them some support and a listening ear.
My name is Nina Morgan and I am the Chief Nursing Officer at University Hospitals Coventry and Warwickshire. I'm really delighted to be talking to you about our Compassionate Communities project and all the work that we do to support patients in their own home predominantly, but also when they're in hospital, when they're nearing the end of their life. Having people who want to and are willing to care for people and sit with people and be with them towards the end of their life, for me, is hugely supportive as a nurse, but is fantastic for our patients and their loved ones.
My name is Jagtar Singh and I'm Chairman of Coventry Warwick Partnership Trust. The purpose of this initiative is so that people who are near the end of life get support, companionship, just when they need it most, but also to support people who have suffered a bereavement that also need that companionship and support when they're at their weakest moment.
Community volunteers can make a real difference in working with palliative patients out in the community setting, particularly those patients who may be vulnerable, isolated or lonely. You know that someone doesn't actually need to see a clinical psychologist, but what they absolutely do need is somebody to talk to outside of maybe family and friends, or for those patients that don't have family and friends to talk to. So I think that timeliness and ability to respond at the point of need is absolutely vital. And obviously, in order to continue to do that timely response, we need more volunteers to help with that work.
I sat with my lady and we had a cup of tea and we chatted, and you don't necessarily have to talk about their illness. You can talk about anything. So if you're even thinking about it, even considering being a companion, please contact us. You can come in and talk to us. We'll go out with you the first time you go out, even the second if you really want it. But all I'm saying is, it is such a good thing to do.
Even if you've only got weeks to live or months to live or whatever it might be, that you're valuable as a human being and that you have potential, and that we should care for each other and support each other, valuing the contribution that all of us can make. Our volunteers in Compassionate Communities support people throughout the last months or years of their lives, being in their homes, talking to them, sharing experiences, going out and doing things with them, helping them to have the confidence to carry on doing things that they might not be able to do. So I'd really encourage you to come and talk to us. You may come and talk to us and actually find, oh, actually that's not for me. But come and have that conversation with us, because you might be just the person that we're looking for.